What is the pharmacokinetics of long-acting injectable antipsychotics? Imagine taking a medication that works steadily over weeks or even months, helping people with schizophrenia stay on track without daily pills. That's what long-acting injectable antipsychotics do. They are specially designed to release medication slowly into the body, making treatment easier and more consistent. But how exactly does the body handle these injections? Let's break it down. First, these medications are usually given as depot injections, often in oil-based or polymer-based formulas. When injected into a muscle, like the deltoid or gluteal muscle, the drug begins to slowly dissolve and enter the bloodstream. The rate of absorption depends on the formulation and where the injection is given. For example, some formulations like risperidone implant microparticles can reach effective blood levels within 12 to 48 hours without needing extra oral medication. Others might need a few days or even a week to fully kick in, so doctors sometimes recommend an initial overlap with oral medication. Once in the bloodstream, the drug distributes into various tissues, including the brain, where it exerts its effects. The drug then undergoes metabolism mainly in the liver. Different drugs have different pathways. For instance, risperidone is converted into an active form called paliperidone. Factors like genetics, other medications, and liver function can influence how fast the drug is processed and cleared from the body. The key feature of long-acting injectables is their extended half-life, which is the time it takes for half of the drug to leave the body. These half-lives are much longer than those of oral medications, often ranging from 2 weeks to 3 months. For example, aripiprazole monohydrate, a popular long-acting injectable, is available in formulations that are administered once a month or every 2 months. This slow elimination allows for less frequent dosing and helps keep medication levels stable. Because of this steady releases, the risk of plasma level fluctuations drops significantly. This means fewer symptoms, flare-ups, and a lower chance of relapse. It also makes it easier for clinicians to monitor adherence, since missed injections are obvious. If a patient skips an appointment, it's clear that medication levels might drop, prompting timely intervention. Injection site and individual factors can influence how quickly the drug gets into the bloodstream. For example, some evidence suggests that injections in the deltoid muscle may absorb slightly faster than gluteal injections, especially at the start of treatment. Body mass index and sex can also affect how the drug is cleared, with some studies showing higher blood levels in women and people with higher body weight for certain medications. Adjusting doses of long-acting injectables requires careful planning. Since these drugs stay in the body for weeks or months, changing the dose or switching from oral medication involves understanding the pharmacokinetic profile. This helps prevent side effects and ensures the medication remains effective. In summary, long-acting injectable antipsychotics are designed for slow, controlled absorption, resulting in prolonged half-life and steady drug levels. This pharmacokinetic profile supports better treatment adherence, stable symptom control, and fewer relapses in managing schizophrenia.